My name is Mary Jo, and I chose to do my presentation on Graves' disease, an illness which I was diagnosed with in 2015. What's in a name? The medical term Graves' disease was first used over 150 years ago. It described a disease which caused overactivity of the thyroid gland. It was discovered and named after an Irish physician named Robert Graves. What is the thyroid? The thyroid is a butterfly-shaped gland which usually sits slightly below the Adam's apple on the front of the neck. It is part of the body's endocrine system. It produces two hormones, T3 and T4, that are essential to our well-being and health. Though not that large in size, this gland performs important functions within the body. Thyroid gland functions. Before discussing the complexities of Graves' disease, it's important to understand the role the thyroid gland plays in our well-being. T3 and T4, the hormones produced by the gland, affect and/or control many bodily functions such as body temperature, body weight and metabolism, cholesterol levels, breathing, heart rate and blood pressure, muscle strength, menstrual cycles, central and peripheral nervous systems, and digestion. What is Graves' disease? Graves' disease, which is also known as autoimmune hyperthyroidism, is an autoimmune thyroid disease. An autoimmune disease occurs when an individual's immune system creates high levels of certain antibodies, which in turn trigger a hyperactive immune response. In the case of Graves' disease, these antibodies target the thyroid and its rate of hormone production, tricking the thyroid into producing more T3 and T4 than the body needs or can tolerate. So if we break it down into steps, an unknown cause leads to the immune system making antibodies which target the thyroid. Those antibodies attack the thyroid and lead to overproduction of T3 and T4. And high levels of T3 and T4 can cause symptoms such as weight loss, muscle weakness, digestive issues, mood swings, and cardiovascular issues, just to name a few. Other symptoms. Symptoms will always vary from patient to patient and in severity, depending upon disease progression. Most, however, will present with some or all of the following symptoms: unintended weight loss, increased heart rate and/or palpitations, high blood pressure, extreme fatigue, muscle weakness and joint pain, anxiety and nervousness, nausea and vomiting and digestive upset, vision and eye changes, and heat intolerance and profuse sweating. A telltale sign of Graves' disease. Thyroid eye disease, or Graves' eye disease as it's also known, causes very distinctive bulging of the eyes in some patients. The eyes appear larger than normal as they're forced forward in the eye socket. I'm unfortunate enough to suffer from a severe case of thyroid eye disease, and as you can see from the picture, the eyes look huge. The same antibodies that attack the thyroid can also attack the tissue and muscles behind the eyes, and there's only so much space in the eye socket, or the orbit as it's called. When there's too much swelling and inflammation, the eyeballs literally get pushed forward, causing the eyelids to go up and back or retract, and you have more of the white of your eye showing. Sometimes it's impossible to close the eyes. You suffer from a lot of dry eyes and tearing, and the vision can start to deteriorate. Diagnosis. When a patient presents with symptoms that may indicate the thyroid gland is overactive, the doctor will order the following blood tests to determine if Graves' disease is the appropriate diagnosis: TSH, or thyroid stimulating hormone, T3, T4, free thyroxine, thyroid stimulating immunoglobulin, thyroglobulin and thyroglobulin antibody, and antimicrosomal antibody. The first four on the list are basic thyroid function tests, and the last three are autoimmune markers, which indicate that the cause is an autoimmune disease. Treatment. Once diagnosed, the patient will be referred to an endocrinologist, a medical doctor who specializes in the treatment of thyroid disorders and other endocrine system diseases. The first treatment option is usually an oral medication, known as methimazole, aimed at slowing the production of thyroid hormones and thereby halting the disease process. Depending on the severity of symptoms and whether or not other organs or body systems are affected, additional medications may be prescribed as needed. Additional treatment options. If the oral medication methimazole fails to lower the thyroid hormone levels to an acceptable level, or if complications in other organs or body systems persist after treatment, the patient will be offered one of the following options. Radioactive iodine treatment. Patient is administered an iodine tablet laced with a given amount of radiation based on body weight. The thyroid processes iodine, therefore the radiation will be directed entirely at the thyroid gland, with no harm to other organs. The goal is to render the thyroid gland inactive. Thyroidectomy, the surgical removal of the thyroid gland. I personally, since I did not respond to the oral medication, chose the radioactive iodine treatment. While I didn't like the idea of radiation, it was at least less invasive. I didn't have to have surgery or anesthetic, so that was the option I chose. It seemed to lower the hormone levels, but my thyroid eye disease has continued to progress. Prognosis. In standard cases with no complications, which would not be mine, I definitely do not fall under the heading of a standard case. If oral medication such as methimazole is effective in reducing T3 and T4 production, no further treatment is warranted at the time. If radioactive iodine is administered and is successful in shutting down the thyroid gland, or if the thyroid is surgically removed through a thyroidectomy, replacement hormones must be taken indefinitely to maintain healthy levels of T3 and T4. Lab tests will need to be done at certain intervals throughout life to ensure levels are where they need to be. If not, the dosage of the replacement hormones will be adjusted accordingly. My endocrinologist has me have my T3 and T4 levels checked every 3 months, and over the last 3 years, or 2 years I should say, since I took the radioactive iodine, my dose has been adjusted both up and down several times. It's just a balancing act. There's no cure for Graves. It's just all about treatment, and you have to maintain a certain lifestyle and taking your medication throughout your life. Risks and complications that may affect outcome. Thyroid storm. Luckily, this is one complication I did not have. It occurs due to untreated or undertreated hyperthyroidism. It can be life-threatening. Symptoms include profuse sweating, very high fever, confusion, and rapid heart rate. This complication is most likely to occur pre-diagnosis or in the beginning stages of non-invasive treatment. So in other words, it's most likely to occur in someone who's completely unaware they have Graves' disease, or they have been diagnosed but given just a low-dose oral medication that isn't effective enough at calming the hormone levels. Atrial fibrillation. I do have personal experience with this. Also known as AFib, it is a condition that causes an irregular and rapid heartbeat, with the heart often skipping beats. Left untreated, it may lead to stroke. And thyroid eye disease, which as I mentioned, I also suffer from. Also known as Graves' eye disease, inflammation occurs within the orbit behind the eyeball, which gradually pushes it forward in the socket. This can cause undesirable changes in appearance, changes in vision, inability to close the eyes, and possible compression of the optic nerve, leading to further deterioration of vision. In severe cases, steroid infusions, radiation treatments, and/or surgery may be required in an effort to preserve the patient's vision. It may persist even after the thyroid has been removed or rendered inactive by radiation. And that's the case with me. This is just a brief tutorial on thyroid and Graves' eye disease. The doctor speaking is what's known as an oculoplastic surgeon and an ophthalmologist, specializing in surgery on the eyes. This is the type of specialist that I have to see at Ohio State University's Havner Eye Institute, who's performed 3 orbital decompression surgeries on me as of now. In closing, Graves' disease is a disease that causes the thyroid to become overactive. The disease can cause a variety of different symptoms affecting the entire body. It occurs when changes in the immune system create antibodies which target the thyroid gland. The exact cause of this autoimmune disease is still unknown. Treatment is dependent upon a patient's symptoms and the organs or body systems involved. Complications, while not common, can lead to total vision loss and even death. If you'd like more information on Graves' disease, please visit the website listed below.